So thank you for joining us again, Jacoby. Today, we're going to just start by talking a little bit about what you do as a social worker now and some of the areas that you've had experience in. And then we'll turn our eye towards mental health issue that is really common in the Caribbean population.
So in Memphis, where I live, I work with dialysis patients. And that's one of the good things about being a social worker. I'm licensed, right? So you have the ability to do more private stuff. Before I used to contract with the state, and I would do a lot of commitments, a lot of going out on the scene and assessing people's just safety, their mental health, levels, and if we needed to put them in a higher level of care, based on my assessment, we're able to do that. So now I've transitioned to dialysis, which is just for me way more, it's a bit more ease. I'm able to connect with a patient more long-term. I'm able to help them in this daily reminder of how close to death they are, So I'm able to add a different value, there's this awareness. And now for many of them, there's this willingness to want to do and be better. So I enjoy that. And I'm with them every day. And that's one of the biggest advantages with being a social worker. So you can be in the juvenile system, you can be in the court system, you can be in the school system, you can be in physicians' offices or outpatient centers, cancer clinics, hospitals, or you can have your own practice. I did start out more in the field. I did start out doing, going to people's homes and being in their environments and helping them adjust and cope with whatever it is in their environment. Then I transitioned to hospital, more acute, more instability, more in the moment, making, decisions. There's no long term, it's right now you're unsafe and what we gonna do. And you're building this immediate rapport. You're building this immediate connection and trust. And, especially when dealing with mental health, the paranoia is real. Everybody is out to get you. And so you develop those skills where I need you to trust me. And what are our commonalities? I love that. But you don't need that immediately with dialysis. Yes, we're still compassionate. We're building rapport and all of that. But I'm going to see you 3 times a week. You become way more like family. They want to know how your children are doing. I want to know how their family is doing. And so with social work, you are able to focus on a person's entire, you have that ability to focus on their mental health, knowing that their environment plays a part, knowing that their health plays a part, knowing that their economic plays a part, knowing that, and then we add on everything else, like the trauma, like how they're coping, like, all the other stuff. But with social work, you're really able to focus on all of that.
You have worked with a wide variety of patients, both in the field and in the hospital system, and also individuals who are very medically ill. And you've seen your fair share of, basically, it sounds like a lot of different kinds of mental health issues. Let's talk about substance use. What is substance use?
So for me, it's any substance, whether it's alcohol, prescription, marijuana, anything that we are using to deal, to cope, to get by. And it's now at a place of need. It's now what I need this to do this. I need this to get by. It is something where Caribbean or American in any culture, a lot of us have witnessed, our parents or family members or whomever coping this way and not even realizing what was going on until now being in mental health, you're able to be like, oh, life was super hard and you were abusing alcohol or, especially in the Caribbean culture, there's this notion of we love our rum, we love our beers, we love our weed. That's kind of socially accepted, that's kind of culturally accepted. And there's not this knowing that you're abusing it. There's not this knowing that it's, illegal or legal, whatever, but there's not this knowing of I'm using this to cope, to get by. It's truly just whether we explain it's just recreationally, it's just socially, we just at the beach, that's what we do, or it's spiritual based. You know what I'm saying? There is a big tie with marijuana, and a spiritual association, so being in mental health, baby, you only culturally, right? You only think those hard drugs are something to be concerned about. I'm being sincere, like whether it's heroin, crack cocaine, you don't think though, those are the ones that you really need to be concerned about from an islander's perspective. Okay. So now moving up here and training in substance abuse and helping all these people create these plans. And I really had to sit with, just what does this mean? Just what does all of this mean? Because now you're learning, now you're getting a different perspective. Now there's this new awareness. You can sit with so long with cultural things just kind of being embedded in you, and that can go before your textbook training, and so substance use is big for me, especially when it comes to just the marijuana or the things that are just like naturally cultural appropriate for us, because I had to create a different perspective of it. I had to heal, and I had to get a true and a better awareness. So with substance use now, with my patients and with clients is, of course, assessing their readiness, but kind of letting them see the difference between it being cultural, it being social, it being spiritual, and having them see the need and the fact that they're now using it as a crutch. And yes, at one point it did calm you down, but now because you're abusing it, you're more anxious, you're more agitated, you have no patience, and you have no energy. You come in late to dialysis. You know what I'm saying? Like you're so high, you're missing your treatment. So a lot of my patients, which I understand, they're coping the best way they know how. We want to inspire them, right? We want to give them their rights. We don't want to take anything away from them. We want to keep them as independent and in right perspective as we can. But we also have to be aware, and we often have to hold them accountable. And so a lot of my just interactions with them now is coping versus need. Do you know? And beneficial versus non-beneficial. And if it's making you lay down on the couch, you just passed out, you're missing your treatment, then this is no longer serving you, So now I've transitioned to working with substance abuse in that way. But my cultural background, I was forced to, okay, it can't just be cultural and social and you know what I'm saying? There has to be this awareness of, I get the coping piece, and I'm not speaking, I'm just being in general. I'm not like promoting alcohol, weed, heroin. No, I'm just saying you have to meet your patient where they are. And if they're abusing something every day, they don't know at this juncture that they're abusing it. You know what I'm saying? They're really thinking, no, this helps me. And so they need the professional to kind of give them big picture, kind of spread it out for them. Like, well, what happens when you smoke 6 blunts? What happens when you have 3 things? You have to paint the big picture for them and let them see their own behaviors and how it's just giving them not the best quality of life. I try now to just, okay, where are we in terms of it truly benefiting and coping to it now being a disservice, because they have this high attachment, that this has been there for them for this long, and so I kind of transitioned into just treatment, just work with my substance abuse, especially dealing with the dialysis population. They know they know their fluids are limited, but they're going to include a few of those ounces being alcohol, and they, and so you have to kind of sit with that and help them to not need it, especially as they're seeing a big trauma, especially as they're seeing no control, especially as they're seeing, I just had to lose my leg and you telling me not to drink alcohol, so that's unrealistic. I really have to meet them where they are. Substance abuse is really big with mental health, people that are medically compromised, just everyday working people. Substance is big because we have now these more pleasing associations with it, and I had to sit with that because I had a pleasing association with it. It's cultural, it's spiritual, it's just what we do, so you kind of got to strip away from all of that. And there is no differentiation whether it's alcohol or heroin. You know what I'm saying? And I had to strip away from that, and you have to treat it all the same, from a, it's not a coping, it's not helping you. And you gotta show them that.
You're saying so much. And there's so much goodness in what you're saying. So the part that really, there are many parts that stand out to me, but the part that I'm going to talk about is this not coming with a judgmental approach.
Yeah.
And that is informed by understanding where the person is at and where they're coming from. So really getting into their space and into their mind and into their understanding.
Yeah.
There's so many individuals who might be abusing substances, who might have a substance use disorder, who might be relying on substances to cope, any which way you want to say it, who are now in families and the families are hurting. And so the reaction is to be mean to the person or to be judgmental to them.
Yeah.
And while it's quite complicated and the family may need to draw boundaries, at the same time, it's important to understand what individuals who are using substances to cope are going through.
Yeah.
And you also said another thing too, that people use substances to cope. And sometimes it's to cope with something else that's an issue.
Right.
Whether it's another mental health issue, whether it's depression, whether it's anxiety, whether it is loss, whether it's trauma, they're using that.
Right.
And so it's hard to get to work on that if the substances are being used to cover it. Mm-hmm. And so it's going to turn into a never-ending cycle. Mm-hmm. The other thing is that substance use issues can sometimes take on a life of their own. So it becomes this crutch, it becomes this friend, it becomes this something that you are physically dependent on, that if you don't have, then you feel really uncomfortable, you get sick, or maybe even worse. Next time we are together, we're going to talk more about some of the skills and strategies that you apply to your own life to support your own mental health and well-being.
Yes.
All right. So I'm looking forward to it.
Yes.
Hey, family. If you're finding value in our content, don't forget to like, share, and subscribe. Your support helps us reach more Caribbean immigrants who need guidance, encouragement, and a safe space to talk about mental health. Let's build this community together because our well-being matters. Hit that subscribe button and turn on notifications so you never miss an update. One love.